Hello everyone, good afternoon. This is Mr. Matus, and for today I'm going to be discussing hip fracture. Hip fracture is a very important topic in the NCLEX, and there are certain things that you need to remember about this type of injury. So let's go and proceed and discuss this topic today. So hip fractures are a serious problem for older adults and most commonly result from falls in the home. And complications from a hip fracture in older adults often lead to death. And generally, when you say hip fracture, the most common problem that we see when this happens among older patients, especially if they are above 65, would be that intracapsular fractures disrupt the blood supply to the head of the femur, causing the development of a vascular necrosis, which is the failure of the area to heal because of a problem in circulation. So what are some of the assessment findings in hip fracture? Number one, you have severe pain, and that indicates that there is a severe injury, which is a hip fracture. Next would be paralysis. So the person having a fracture will be unable to move the extremity because of the severe pain and the deformity. Next will be edema that happens because of the injury also. And then also very common in the NCLEX will be your shortening or external rotation of the leg. So you have to remember this, that when you answer in the NCLEX, it is not external or internal rotation, but rather external rotation. It's not lengthening of the extremity, but shortening of the extremity. Also, hearing a snap or a pop is a sign that there is a fracture. And also lastly would be the crepitus, which is the grating sound because of the fractured fragments of the bone. And then the last one will be your shock. So patients with hip fracture could develop hypovolemic shock because of severe bleeding. Now, what are some of the interventions in hip fracture? One, you have skin traction may be applied before the surgery to decrease muscle spasm, and usually that's the answer in the NCLEX. Surgery will be done by means of arthroplasty, which is a repair of the affected hip. And of course, in the worst case scenario, that would be your total hip replacement, which is the replacement of the head of the femur with metal prosthesis. Now, after surgery, there are certain things that needs to be remembered, and usually these are the focus on the NCLEX. You have abduction of the legs, usually with the use of the abductor pillow. And the abduction of the legs is very important because we want to prevent dislocation of the hip. So in the NCLEX, never answer adduction, but you have to answer abduction or separating the legs of your patient. The head of the bed must be elevated at 45 degrees, and it must be positioned in such a way that the patient does not bend the hip beyond 90 degrees, because if the patient bends beyond 90 degrees, then that results in dislocation. So these three over here are priorities in the NCLEX. They usually are being asked in the test question, so you have to really be very careful. We have to instruct the patient not to cross the legs. That's a very common question in the NCLEX also. And also not to wrap the legs with the blanket together, which means to say that as much as possible, it's all about preventing adduction. So we have to promote abduction but not adduction. Avoid low toilet seats. So there are certain devices that could be used to elevate the toilet seat of the patient. And again, this goes back to preventing, avoiding, or the flexion of the hip more than 90 degrees, which could lead to dislocation. And lastly, in the hospital, patients will be also wearing the anti-embolism stockings, and that is to prevent DVT or deep vein thrombosis. Patients with hip fracture are prone to develop blood clots in the legs, so they're also being given anticoagulation meds to ensure that they don't develop thrombophlebitis. And of course, most of these patients will be out of bed on the first day for rehabilitation. They will start walking, and there will be specific orders for the weight-bearing status of the patient. So my quick tips for you in the NCLEX is to remember the symptoms or the assessment findings in patients with hip fracture, especially the shortening or external rotation of the leg, and also the presence or the possibility of a hypovolemic shock. And don't forget the positioning after surgery, because this is a priority in the NCLEX, and usually you'll encounter a lot of questions about these items that I have marked in this slide. So there you go, everyone. That was just a very quick review of the hip fracture. So if you have any questions, please post your comments below. And please don't forget to click like, share my presentation, or subscribe to my channel. And please visit my website also at www.matusnursingreview.com. Thank you very much, everyone.